So that we don't forget, we have to continuously reinforce what we already know. So the topic of my presentation really is plaque is the enemy. And I was already introduced. So I'm a student of the University of Technology. I'm in final year, or my final months. My email and my number is there for those who don't have it. And if you have like any, there will be a question and answer section at the end. There'll be a question and answer section at the end of the presentation. I'm not going to say that part, Brother Sterling. So, yes, there's a question and answer section. So, if you have any questions, try not to do anything too personal, like ask anything too personal. Anything like is our personal matter, I'd prefer you email or WhatsApp me. I'm very proficient at WhatsApp. And general questions that everybody can benefit from, please feel free to throw it out there. So we all can benefit. The presentation was already done at Huntspen, so if you get bored, my sister, and bored Brother Sterling, please pardon me, right? I want a certain amount of consistency in terms of the information that I present to the audiences. All right, so oftentimes we find that we go to the dentist when we feel pain, right? Most of us only see the dentist when we start feel a problem or a toothache or something's wrong in our mouth. Almost, I don't want to say it because Mapen brethren are not like that, but almost like some Christians who only go to God when something is wrong, right? When, you know, if we had been practicing, I forgot, sorry. Yes. Almost like if we had been praying constantly and reading our Bibles every day, then we would avoid that. We would avoid, or at least we would be very ready for the circumstances when they come upon us, right? Of course, you guys can't relate because you talk to God every day and we read our Bibles and we pray. So most people only go to the dentist when they're feeling pain. So the pros of going to the dentist are that the dentist can help you to relieve pain and sensitivity. We can help you if you notice any abnormalities in the mouth or in the jaws, which happens sometimes. If you just want an examination, you want to know what's going on, we can help you with that. It also enhances the procedures. Sometimes you have issues with your teeth that, you know, when going to the dentist can actually help to enhance, right, the beauty, the aesthetics. Some people are getting married, they want to whiten their teeth if that's important to you. Or you might be missing a tooth and you're getting married, you know, you want your husband or your wife you don't want them to know that, you know, you had missed a tooth before. All right, and a wide array of services are offered. So the focus of this presentation will be on care of your teeth, as well as what will happen or what happens when we don't care for our teeth. So the major thing that I want you to remember, and I'm going to reiterate it at the end of the presentation, is that a balanced diet is crucial to care of your teeth. Exercise, the new start, the same thing I started with, the exercise, the water, the sunshine, and all of those things. But of course we don't always keep up with that, and we live in a sin-cursed world where things go wrong. Thank you, Brother Brown, right? And so sometimes we need the assistance of our brothers and sisters to take care of some matters when things go awry. I have to get used to using this pointer, sorry. All right, so the cons of going to the dentist. Many people will say that it's expensive. You know, I don't have the money. I can't afford to go to the dentist on a regular basis. Really, we ought to go to the dentist how often? How often, brethren? I hear it, one person saying it. How often should we go? 2 times a year, every 6 months, right? Because changes can occur and you want to be on top of any changes that might be going on in your mouth. Also, going to the dentist, you lose time from work or school, especially if you're having pain or you have to get a procedure done that requires multiple appointments. You lose time from work or school, especially the children. So if you can go for, say, a cleaning or a filling, which is a shorter kind of procedure, you want to go for that instead of doing like something like a longer, a root canal, which requires more time and so on, and you have to spend more time from work and school, right? It's also uncomfortable. Most of the procedures are done under or with the use of local anesthetic. Some people, if you're afraid of needles, then you have to consider that. If you don't want to have to endure all of that, then you want to make sure that you take care of your teeth, proper care of your teeth. Loss of bodily tissues or body tissues. So the tooth or the teeth is a part of the body, right? And when we lose our tooth, some of us feel as though we lose a body part. If you have never lost a tooth, hooray to you, right? I lost my first tooth when I was 17 years old, right? It was of no will of mine. One day it was getting cold. I think it was in March. It was kind of cold, and my tooth was hurting every time I drank something cold and so on and so forth. And I went to the dentist, and the options were presented, which was, of course, a root canal or extraction. And because of financial reasons, and I was a child, I was 17, so I said, okay, take it out because I need to be able to function. But best believe I mourned for my tooth for about 2 days. I mourned. I felt as though I had lost a body part. I felt as though I had lost an arm or a leg. I was very sad. So unless your tooth is not important to you, then losing a body part is neither here or there. But we really don't want to have to lose teeth unless they are your third molars, which are considered dispensable. Complications can also arise. Sometimes you go to the dentist, and sometimes everybody's teeth are not the same, and sometimes things go wrong. So if we had taken care of our tooth properly in the first place, we really wouldn't have to go to the dentist. Sometimes we really can't avoid going there. So, but that's just so you know. A wide array of services are offered, as I said before. Cleanings, extractions, fillings, dentures, root canals, implants, and crowns. Everybody knew about this already. Everybody knew about all of these services, right? Everybody know that you can get a screw in your jaw if you lose your teeth. You can get dentures if you want to replace your teeth. Crowns are offered as well if the teeth are kind of discolored and so on. And cleanings, which are very important, and your fillings if there is a hole in your tooth. All right, so I'm going to start showing some pictures now. And here, let me point. Here is a picture of a milk tooth. It's a baby tooth. Everybody seeing it? Yes? People at the back, Sister Hales, you seeing the picture or you don't? Yes? So here is a picture of a baby tooth, right? 1, 2. And they both have cavities. And you might say that, okay, they are children and the baby tooth you're going to lose them anyway, and you don't need them. But I have news for you that the baby teeth are very important, right? Mothers, fathers. The baby teeth are very important. Your child, once they reach the age of, once they have teeth, you need to start taking care of them, right? Once they reach 2 years old, you need to be flossing the baby's teeth, right? And children are actually supposed to be supervised in brushing and taking care of their teeth, flossing up to the age 8, right? So if you have children who are below the age of 8, you need to be supervising them, brushing their teeth with them, showing them how to brush their teeth and doing it every night. Because if you don't, this happens, right? And most of the times, and I emphasize the flossing because most of the times, most of the fillings that I do on children are fillings that are as a result of not flossing, right? So we really want to get those in. And this here, this tooth was restored with a filling, but it wasn't, it was kind of a complicated filling where we had to go in and take out some of the pulp and cause the tooth to bleed. But the good part of the story is that we ended up saving the tooth. So that's a pro, right? Okay, we get to keep our teeth. So the baby teeth are important in the growth of the jaws, if I didn't say it. It's important in the growth of the jaws of the child. It's also important in space maintenance for the eruption of the permanent teeth. So if you don't want your children to get packed teeth when they become adults, then you want to help them to take care of their teeth. Okay? So here is another cavity in a baby tooth again, and this time it was restored with a stainless steel crown. That is, I think my battery is gone, right? But you see the silver looking thing on the side, that is a stainless steel crown, and it will stay in the mouth until the tooth is lost, right? When the premolar comes up, it will be lost with the baby tooth. Here is a permanent tooth, or adult teeth, of a young lady. And I'm not sure if you can see it very well, but you can see the darkness in between the teeth right there. And this is the underside of the teeth, the darkness as well. And the tooth was filled. So, possibilities, right? Here is one of my full mouth rehabilitation patients. He came in with a lot of problems. He's a very good Seventh-day Adventist and a good friend of mine. He had a lot of caries because, of course, he confessed that he loves the sugar and he loved to eat, the sweets and so on, and he didn't really practice good dental hygiene. So he was about to, a couple of his teeth, 3 of his teeth had to go. We had to take it out, and so we end up with a space here, right? We end up with a space in the mouth and a space right there. Sorry. We end up with a space right there as well. So we placed an implant, which is a screw in the jaw. It healed for a while, and then we placed a crown on it, which is what we're seeing here. So the crown, so this space here is this right here, right? And this space here is this right here. This was the temporary crown, so it doesn't look as wonderful. The permanent crown looks better. But you can see that his smile has been restored, right? Wonderful possibilities that are available to you. This was one of my dear cases that I guess meant a lot to me, because this young man came in with fever and malaise. He missed school. He had hit up his tooth. Or let me tell you the story better, sorry. He was playing with his friends, right? And his friend hit his face in a wall. And he broke the tooth. And when the tooth broke, his mother, the mother of the boy who hit his face in the wall, paid for him to get it filled and so. So the tooth was filled and the filling broke off a couple times. And he came in with pain and fever and malaise, and it was just whatever. So when we examined him, he had like a gum boil, which Right. Most people know it as a gum boil. So he had an abscess up at the tooth right there. So if you think that your tooth cannot kill you, brothers and sisters, that is not true, right? So we had to give him antibiotics, painkillers and stuff, because what happens is that if you have an infection in what we call the danger zone, which is a triangle. If you have an infection in this region here, which the front teeth would fall into that triangle, then you run the risk of putting yourself or making yourself susceptible to a medical emergency, right? Which means that you could die from what they call, a big word, cavernous sinus thrombosis, right? So we gave him the antibiotics, and I was really upset because I didn't take the picture of when he came in first time, because I guess I was focusing on treating him. But this is the second time. The second time he came in, I got a picture in, and I took the picture of everything and so on. So if you notice, his face was a little bit made up, so he was kind of conscious about his smile. He didn't like to smile. And so we went ahead, did the root canal. So that's a little bit, yeah. Did the root canal was completed, built up the tooth, and this is the smile that I got afterwards, and I was very happy. So those are the things, those are the rewards that I get from helping somebody to fix their smile. And all of these are my patients, guys. All of these are my patients and my photos. Here is another patient of mine. So he has no teeth. And so the top right corner, this is what you're seeing is ridges, right? Ridges, this is top ridge. This is the bottom ridge, the gum, right? Right? So what we did for him, we built complete dentures, right? And this is it in the mouth. This is only a part of it. But this is him. He's smiling. He was very happy. Now this man, I did not know he could smile, right? His face was just always straight. And no matter if I gave him a joke or anything, he was just always serious. And the first time I saw him smile was when I gave him the denture, delivered the denture. And he, ever since, you know, we became best friends. Every time he see me on the road, he called to me and stuff, he started smiling. And if you never thought, if you don't think your teeth are important, show of hands of those who don't think that their teeth are important. So everybody think that teeth are important, right? Okay, good. So I have only friends here. So all of these that I just showed you are interventions, right? Because we believe, right, that prevention is better than cure. So we don't want our teeth, we don't want to lose our teeth, we don't want our teeth to start hurting. The primary care of our teeth lies in our hands. The dentist is just a helping hand, right, in all of this. So how can we take care of our teeth? The basic principle that I want to say is that plaque is the enemy and oral health is our destiny, right? So here, meet Betty. Betty is a fake name, but this is a real patient. And Betty, what is interesting about Betty, or was interesting about Betty for me, is that Betty had the dirtiest teeth I had ever seen, meaning that she had plaque on all the teeth. She had plaque on all her teeth. She looked like she had not brushed in days. She had cavities. She had cavities in all her teeth, right? And it could have been because she came in because of pain in one of her teeth that she went to a quack to take out. And a quack is a dentist that is, well, a quack is actually not a dentist. A quack is a person that is pretending to be a dentist. So they are doing procedures and things that you really should be going to a dentist for. And the dangers of that is that they are not equipped with the knowledge, the requisite knowledge and tools to treat people. So if something goes wrong, you really will be in trouble. So this is what happened to this lady. She went to a quack, and the quack was taking out this tooth that really is a difficult tooth to take out. It's just not a normal extraction like that. And the crown of the tooth broke off, and they left it in there, and so she has tremendous pain. So she came in, she wanted to take out the tooth. So I did an examination, which is standard procedure, and this is what I found. So Betty has a lot of plaque on her teeth. And if you don't know what plaque is that, let me see, well, here it is, the definition. Dental plaque is defined as a specific but highly variable structural entity resulting from sequential colonization and growth of microorganisms on the surfaces of teeth. I hope I'm not blocking anybody. Are we seeing it well? I'm going to break it down, Brother Brown. I'm going to break it down. Sorry. Right. So let's start over. Dental plaque. So I've been using this word a lot. So let's define it, right? Dental plaque is defined as a specific but highly variable structural entity resulting from sequential colonization and growth of microorganisms on the surfaces of teeth and restorations consisting of microorganisms of various strains and species are embodied in the extracellular matrix composed of bacterial metabolic products and substance from serum, saliva, and blood. Now, I had to put some big words in there, lest you guys think I am some bogus person who didn't go to school coming to talk to you about your teeth, right? So, let's break it down a bit, right? Let me tell you about the plaque now. Now, the plaque, if you guys probably would have known about this a little bit. So, what happens? The plaque is where the bacteria live, and the bacteria, if you probably, all right, right. So the plaque is where the bacteria live. There are over 800 species of bacteria living in the mouth, right? And these bacteria, they are very wise bacteria. They live in communities. And they stick together. So human beings are the only species that don't stick together. They stick together, and what they do is that they build a fence around themselves to protect themselves from they build a fence around themselves to protect themselves from the environment. And the fence is the matrix that they were talking about right there. So it is not easy. If you've done it before, which I know I have, and some people might not be willing to say, but if you rub your teeth, if you go without brushing your tooth for about, say, a day, right? Because we really should be brushing our teeth every day. Let's say a day, you rub your teeth, you rub your tongue over your teeth, you're gonna feel that roughness, right? Right, kids? You ever and you feel a little roughness on your tongue, right? That is the plaque we're talking about. That is where the bacteria live. And when the bacteria are in the plaque, they live, and just like us, when we live somewhere, we produce garbage, right? So the bacteria produce their garbage. Their garbage is acidic. And the acid that they produce, because they live on the teeth, the acid that they produce breaks down the structure of the teeth. And the teeth is made up of calcium phosphates, linkages or bonds, and those bonds can be broken by acidic environments which are lower than 5 pH, than the pH of 5. So the bacteria is basically breaking down the structure of your tooth. That is how cavities are formed. So this is the cavity where, right? You see the cavity? Right. So she has a cavity forming. She has cavities, but that's an obvious one that you can see, right? So plaque is everybody understand the definition now of plaque, right? Pardon? It's a build-up. It's not necessarily food, no, it's not just food, it's bacteria. And the bacteria, they like the food that you eat. And so they survive on it. And so if we eat our lettuce and our melon and our mangoes and our stuff, we find that less plaque will build up. Plaque will still build up, you know. But less plaque will build up as if you, right, less plaque will build up as opposed to if you had eaten like like a cracker or a biscuit or something sweet, right? Because the bacteria, they feed on the sugar and the sugary environment, right? So we really want to be eating all of these wonderful things that God has blessed us with, right, brethren? So the plaque is the disease-causing agent of caries and periodontal disease. And I want that to soak in, because caries and periodontal disease, caries is the nice word for cavities, right? But caries is like the first part of cavity formation. So meaning that the tooth has not yet gotten a hole inside of it, but it is at the stage where it will, if it stays long enough, the hole will get bigger. So just like those little small sins that we entertain in our lives, brothers and sisters, and we say and we look and we say, well, this is not going to do anything and it's not going to cause any problems, but you know, little by little and step after step and action after action, those actions become reinforced, and then one day just they become a big problem to us, right? Anybody can relate? Anybody knows what I'm talking about? Right, those little things. Because the cavities, brothers and sisters, they start as just a really small dot or a really small area of decalcification on the tooth, right? So that's what I was talking about, where the caries, right? So the caries and periodontal disease, these are the major causes, these are the major things that preoccupy the time of dentists in Jamaica and the world over, right? So if we can get our brothers and sisters to brush their teeth 2 times a day, especially at night, and to floss once a day, we would have accomplished, I would have accomplished a great deal, right? Because, and I say especially at nights, because at nights, and we spoke about the new start, the rest, our body needs rest, right? The salivary glands rest as well. And what happens is that the salivary glands produces the protective mechanism known as saliva for our mouth. So if we do not brush our teeth at night, it means that all of the food that we would have eaten throughout the day would have been given a chance to reign supreme in our mouths, right? And by the time we wake up in the morning, the damage would have already been done, right? So we really don't want to miss that nighttime brushing of our teeth as well as the teeth of our children. So the bacteria is not wasting any time. They're not wasting any time, so we must not be wasting any time as well. No, periodontal disease, we haven't spoken about it yet. Most of the cases I showed you before were of caries and us restoring cavities. But we're going to speak about the periodontal disease shortly. Dental caries, and I just spoke at length about it. But this is a definition from the World Health Organization, a definition as of this year. It's a major public health problem. We will find that we are in the age really of non-communicable diseases. Once upon a time, the medical Medicine was preoccupied mostly with infectious diseases, like your yellow fever and your malaria and all of those things, right? Really and truly, what we're most preoccupied now with our lifestyle diseases are what we really call our non-communicable diseases. And dental caries is really a lifestyle disease, because if you brush your teeth twice a day and floss once a day, you can really avoid it, right? So that's what we really call lifestyle diseases. Your hypertension, your diabetes, your heart problems, all of those things, they really can be avoided if we follow the health message, the Adventist health message that the world recognizes as a wonderful thing, but most of us really don't follow it as Adventists. The New Start is wonderful, brethren. We need to subscribe to it. New Start, nutrition, exercise, water, sunshine, temperance, air, rest, and trust in God, right? So, it is also the most prevalent condition included in the 2015 Global Burden of Disease study, ranking first for decay of permanent teeth, 2.3 billion people, and 12th for deciduous teeth, 560 million children. Deciduous teeth refers to baby teeth, milk teeth, meaning that in 2015, 560 million children were diagnosed with caries. And really and truly, they don't have any data for Jamaica. So imagine if they had Jamaica's data in there, it would be more, right? And for the permanent teeth now, there is 2.3 billion people. Gum disease. Gum disease can be divided into two categories. We have gingivitis. And my professor taught me, my very erudite professor, Dr. Boyd, taught me that everybody has gingivitis. And what happens is that because we have bacteria living in our mouth, as I said, over 800 species of bacteria living in our mouth, some of them being good and some of them being bad, there's always what we call a low grade of inflammation taking place in between the teeth and the gums, right? What happens is that the teeth are like this microphone, and the gums are like my hand holding the microphone. And there is a space, naturally, in between the gums and the tooth. And the bacteria like to live in that space. And the toothbrush, brothers and sisters, cannot get down into that space. And so, when you go to the dentist will go down into that space and clean it for you, right? That is why you need to go to the dentist every 6 months. Not because they want to get some of your money or because they don't have anybody seen, but really and truly it's so that we can control the disease process where periodontal disease is concerned, right? So gingivitis, everybody has a low grade of gingivitis, low grade infection, right? Going on in between the gums. But if it is controlled, it doesn't cause any problems. If it is not controlled, however, then the disease process progresses. And when it progresses, it becomes what we call periodontal disease. Whenever we have periodontal disease, brothers and sisters, we start to lose bone around the teeth. And whenever we lose bone around the teeth, our bones are what keep us standing, right? They keep us erect. In the same way, the bones around the teeth keep the teeth up. Now, if we do not have the teeth holding us up, if we do not have the bone holding up the teeth, then the teeth are going to start wobbling. They get loose. And when the teeth get loose, they fall out. Or, Brother Brown, you can come give the presentation. Right. When the teeth get loose, beyond a certain point, they cannot be saved anymore, and we have to take them out. So, that is periodontal disease, characterized by bone loss. Gum disease, periodontal diseases are prevalent both in developed and developing countries. So it is not specific to us or people in Africa or anything. People in first world countries have it as well. And they affect about 20 to 50% of the global population, right? And what that means is that if we do an examination of this audience, this congregation, half of the congregation, 20%, sorry, to 50% of the congregation we will find will have periodontal disease, right? So 25 to 50% of the global population, high prevalence of periodontal disease in adolescents, adults, and older individuals make periodontal disease a public health concern. There are several risk factors, such as smoking, which Seventh-day Adventists do not do, poor oral hygiene, which is proliferous among everybody, really. Most people who just don't. Most people, you know, really need sometimes a pick-me-up from bad habits. Diabetes, medications can also cause periodontal disease. Hereditary factors can cause periodontal disease. Stress is also related to periodontal disease. So it means therefore that we all are at risk, right? That's the point. We all are at risk of periodontal disease or gum disease. Robust evidence shows the association of periodontal diseases with systemic diseases such as cardiovascular disease, diabetes, and adverse pregnancy outcomes. Well, I think this is pretty straightforward, right? Right? It's saying that there is evidence to show that gum disease is related to adverse pregnancy outcomes such as low birth weight, early delivery, and low birth weight and early delivery. That's the two I can remember right now. Cardiovascular disease, usually whenever so we always say that the same blood that is in the mouth courses through our veins and courses all around our body. And so it will, if there is bacteria in the mouth, that bacteria can cause a problem if you have a heart concern or a heart issue. So if you need to do heart surgery, the cardiologist will usually send you to the dentist to make sure that, you know, everything is going on, you don't have any abscess or any infections, or if you need a filling, that you get all those things out of the way and done, right? So the second paragraph says, periodontal disease is likely to cause 19% increase in the risk of cardiovascular disease. And this increase is relative, in relative risk reaches 44% among individuals aged 65 years and over. Type 2 diabetes or diabetic individuals with severe form of periodontal disease have 3.2 times greater mortality rate, which is death rate, compared with individuals with no or mild periodontal disease. So what that is saying, is that clear, brothers and sisters? Is it clear? All right. Periodontal therapy has been shown to improve glycemic control. That's what I want to emphasize. That if we get our cleaning, our proper cleaning from the dentist, if you have type 2 diabetes, it can help to control the diabetes, right? Periodontitis is related to maternal infection. Oh, here it is. Maternal infection, preterm birth, low birth weight, and preeclampsia. That's the one I forgot. All right, your dentist can help you. So this is a child, one of my children that I cleaned. You're not seeing the calculus very well, but what happens is that whenever we don't practice proper oral hygiene, the plaque can become calcified. And calcified means that it becomes hard like a stone, right? And it stays on your teeth. So it means it's even worse, can't come off with the toothbrush, right? And so we have to, I don't use the word Brother Brown, but we have to scrape it off. The dentist has to scrape it off, right? And that usually restores the gums to a position of health. So, brush your teeth. How do we care for our teeth? We brush 2 times daily, especially at night, for at least 2 minutes, right? Some of us are rushing out to work and we can barely spare 30 seconds to brush. We just brush the front teeth and that is it, and we have to be out. Let us try to spend a little more time in taking care, right? Using a soft toothbrush. And how often should we change our toothbrush, brethren? Every 3 months and after, yes, every 3 months and after illness. Sorry, if you have flu, if you had flu recently, you should have thrown out your toothbrush after you had the flu and get a new one. And right, because you don't want the bacteria, the same bacteria to be, or the flu or the virus to be in your mouth and so on. Of course, we don't share toothbrush. We try not to share toothbrushes and those things. I think it goes without saying that everybody should have their own toothbrush. And fluoride toothpaste. So most of our toothpaste really have fluoride in there. We should floss at least once a day. And I don't want anybody showing off and say, oh, they floss 3 times a day and sometimes 7, because nobody has that amount of time to be flossing their teeth in the day. Sometimes we ask patients, how much times do you floss, or how much times do you brush? And they lie and they write all kinds of things and say they brush so much times and whatever. But when you look inside the mouth, it tells a different story, right? So we really cannot cheat, brothers and sisters, right? We really cannot cheat ourselves or anybody else. So floss once daily. And on the matter of flossing, I said this to the brethren at Huntspen, that there is a new trend going around with the fashion braces. And I've seen personally where the fashion braces has caused a lot of harm to the patients, where the people who are putting on the fashion braces are usually not orthodontists, which is an orthodontist is a specialist. Meaning that after you go to dental school after you go to a dental school and you're a dentist, you go again to study further to become an orthodontist, right? So these people are putting on the braces and they're not telling the people how to take care of the teeth. So they're not taking care of the teeth. So the patients are getting cavities in between their teeth. They're getting the periodontal disease, because it makes it more difficult when you're having the braces to brush it. And I told the brethren at Huntspen that it takes me, on a good day, 10 minutes to floss. It is really, really time consuming. And sometimes 15 if I'm very lazy, but it really takes time to take care of your teeth and just get in between there. You have to use specialized instruments and stuff. So if you are somebody who is actually thinking about getting braces, you want to make sure that you're well motivated to go into it, because if you cannot floss for a minute when you don't have it on once a day, then how are you going to floss for 10 minutes? You don't want to have it in. You need to be motivated, well motivated. Visit the dentist every 6 months. Your children, of course, brushing should be supervised up to 8 years old. I've been saying that over and over. And if you wear dentures, what is up there on the slide, brothers and sisters? Don't sleep in them. And my Spanish teachers, my teachers from Cuba, they said to me, tell the patients, do you sleep in your shoes? So you do not sleep in your denture, right? You do not sleep in your shoes, so you don't sleep in your denture, right? So just like how you clean off your shoes and so on and so forth, you clean your denture. How do we clean our dentures? You can clean they are specialized pills, they're denture cleaners. That you can put it in water and it fizzes. I should have brought some today, sorry, I forgot. It fizzes and you put the denture in there overnight, and when you put it on the next day, it's fresh and nice. No, you need to be brushing the gums as well, because if you don't brush the gums and if you don't take out the denture at night, then the bacteria and the fungus particularly, they love that warm, dark, moist area. And you will get what we call candidiasis up there, or not, it's really denture stomatitis, but it's usually caused by the fungus, Candida albicans, right? So you need to be brushing off the gums, and so because the food gets stuck in there, it gets stuck under there, all of the saliva and all of that. So you want to be cleaning that out nicely. And if you don't have the special pill, you can use 1 part bleach to 10 parts water. What that means is that if you use one cork of bleach, you use the same cork and you fill 10 water, right? And you say 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. All right? So that is it for denture care, right? This is a picture of me in my environment. This is me helping one of my patients from the Salvation Army School of the Blind. So this is actually a blind young girl. I think she's 8 years old. So I was teaching her how to brush and to floss. So you can imagine, we know how to brush. We take it for granted that we can see and we can so on and so forth. So, you know, I had to be trying to help her because right now she brushes and flosses with assistance. So that 8-year-old girl is not going to be 8 years old for the rest of her life, right? So you want her to have a certain amount of autonomy in terms of the care for her mouth, right? So it was a difficult task, but I think she learned. She learned a lot. So we help you to take care of your teeth. That's the point. We help you to take care of your teeth. And that is the end of my presentation. Are there any questions? Yes. Yes, Sister Shah.
First, I want to welcome you here. We are so proud to have you here this evening.
To God be the glory.
Son of the soil, you know.
Daughter.
What would cost, you see? Like, for instance, you're a grown woman, and I'm referring to myself. You have your teeth in your head, no hole, nothing, it's not rotten or anything. But when you look, you have this terrible teeth ache in your mouth. And when you go to the doctor and the doctor did an x-ray with the teeth, he found out that all the nerves of the teeth, the root of the teeth is gone. And that is why it is causing that severe pain. What advice would you give to such a person?
All right. What happens is that most times when you look in your mouth and you don't see a hole in the tooth, when you look in your mouth and you don't see a hole in the tooth, it usually is because, all right, so the tooth, like my fist, is 3-dimensional, right? Most of us when we brush our teeth, we only take care of the top surface and the side surfaces. But if you have all your teeth, there is another surface or 2 other surfaces that touch the other teeth. And that's why we have to go around and floss, because when we don't floss, the cavity develops in between. So the bacteria lives in that space in between the teeth. So you cannot see the hole, but the hole is there. So that is why we try to encourage our patients to floss daily. So the hole is there, and that's the only way you can see it is usually with an X-ray. So that's what happened. So the cavity was so deep and so large that it went to the area where the pulp is, which is the living tissue inside the tooth, and so that's why you were feeling pain, or whoever was feeling pain. Any other question? Does that answer your question, Sister Shah?
Yes, but you know, when me look, me not see nothing at all, and when the doctor look at it, the doctor didn't see anything in there. But when they did the X-ray, you can see that way down. And as a matter of fact, it causes a boil in the mouth, and it causes severe pain, and it let you feel like all the teeth in your head is hurting you. And then it give it a boil, and a boil over there, and all those kind of things, you know. And it's make you very uncomfortable, very, very uncomfortable, you know.
Gum disease can also cause gum boils as well. So it really would, so it's either gum disease or caries. So when we do the examination, you usually can.
He said that the doctor said that it is the nerve. It is the nerves
So that
gone.
sound like cavities.
Yes,
like a
it's the
cavity.
nerves. It completely gone because he didn't say anything either. It was when he did the X-ray. 'Cause I was feeling pain.
Right, right. So you'll find that, okay, when the cavity gets so big and it's been there for a long time, the tissue inside the tooth becomes dead. And what happens to dead things inside our bodies, outside our bodies generally, is that they rot, right? So they undergo what we call necrosis. So whenever you have the pulp necrosis taking place, and you wait for a long time, and even if you're feeling pain, you ignore it or you put something on it to kind of ease the pain or whatever, the action of the breaking down of the dead tissue, because your body is trying to deal with the infection, right? And breaking down the dead tissue, it continues until it reaches down at the end of the root. And when that happens and you reach down there, it causes an abscess. And whenever you find that, okay, you cannot sleep at night, particularly, so pain at night, preventing you from sleeping, usually is because there is an abscess at the base of your tooth, or you have an abscess in your tooth. So, usually how you fix it is either you do a root canal or you take out the tooth.
Okay.
Because your body is trying to control the infection.
Okay. Thank you, Doc.
No problem.
My question, as it relates to halitosis, I would like to know what really causes halitosis and how can it be remedied.
Okay. All right. So halitosis is a popular question and concern among the brethren. I got the same question at Huntspan as well. Halitosis, for those who don't know, is bad breath. It has many causes. It can be caused by tonsillitis. It can be caused by cavities. It can be caused by periodontal disease. So whenever there is some form of infection taking place and your body is trying to control the infection, you usually get that smell of that, that bad smell. So if that is one of your concerns, definitely the dentist can help with that. Okay, yes. All right. Any more questions, brethren? Does that answer your question, my brother?
So if it is a situation where the tonsil is inflamed or is bad, then how will the dentist help with that?
Okay, so infections of the teeth sometimes are drained by the lymph nodes in that area. So the tonsils can become inflamed as a result of that. So if it is as a result of the teeth, then the dentist can give you antibiotics. And so usually we don't really give antibiotics just like that. If it's caused by the tooth, you want to take care of the problem, the source of the problem, rather than just fixing the symptom, which is the halitosis is really just a symptom of a greater problem.
Okay.
Right?
All right, my second question has to do with the ingredients in toothpaste.
Yes.
I noticed you mentioned about fluoride.
Yes.
And there are also other poisonous ingredients. Poisonous in terms of it is cancer forming. How do you deal with that as it relates to you recommending what toothpaste for a patient or anybody per se? How do we deal with the poisonous element in the toothpaste?
Okay, all right. So fluoride has been given, or is being given, I think. Oh, okay. Oh, yes. So fluoride, a lot of people have been saying lately that what you are saying, that fluoride causes cancer. and that fluoride in and of itself is poisonous. Now, fluoride is one of the public health interventions that came about, actually were introduced to Jamaica by Dr. Rosalie Warpio in terms of the fluoridation of the salt. Now, the problem at the time was that the DMFT, which is the decayed, missing filled teeth in the children at the age of 12 was, I think, 6. I don't remember the specific number, but it was very high. And when she introduced the fluoridation of salt, that DMFT, which is the decayed, missing, and filled teeth data ratio in the children, that ratio decreased drastically, right? And so usually as people who are concerned about the health of the population, we usually weigh the pros against the cons. So, and the concentration of the fluoride that is usually placed in the salt, in the water, in the toothpaste is usually below what is considered to be poisonous, which is, I think, 6 parts per million. I think 6 something like that. So it's usually below the toxicity level. Now, you can get the toxicity if you overdose on it, which is usually if you eat toothpaste or something like that, which is usually kind of rare. Poison from fluoride is very rare. So it is not as major a concern as dental caries and periodontal disease is. And so I think that is the reason why we have not thrown it out. And actually, they are even improving on the use of fluoride, because what happens is that the fluoride has this potent anti-cariogenic effect, right? That it makes fluoride almost indispensable in the control of the disease process. But there are toothpaste without the fluoride. There are toothpaste without the fluoride, and so if you want to use that, of course, definitely, you can do that. Any more questions?
No.
When you drink ice water, why your teeth hurt you? Or cramp?
Cramp you?
Yeah, teeth cramp.
Okay. So, if your teeth are healthy and if your teeth are healthy and you drink ice water, just like, okay, so the teeth really only, whether in terms of stimuli, heat, cold, infection, pain, the teeth only interprets or understands one language, which is pain. So it elicits pain whenever the conditions are not ideal. So whenever, I guess, the tissues inside the pulp, because the teeth have living tissues in there, and so if you make the conditions less than ideal for the living tissues, then it's going to say, okay, this needs to change. Yeah. So, any more questions?
I realize that I'm eating sweets now. If I always have a low pressure, but if I eat sweets, the teeth, just like 2 months ago, the teeth naturally hurts. I don't know if it's because it penetrates the nervous part of it or what, but it just hurts, especially my front teeth and the side ones. Since even I ate a taffy, and when I eat it, the teeth just start hurting me. Like it's a hurt from inside, not outside.
Well, your teeth are not supposed to hurt you when you eat. So if that is a concern of yours, you need to visit the dentist.
Like when you eat, you can't drink same time. You can't drink water or anything cold same time.
Well, I think Auntie Madge can answer this one in terms of they usually don't advise. The question is if when you eat, you can drink cold water or drink same time. What you say to that one, Auntie Madge? We usually don't recommend it.
Right.
Right. So we usually say try to eat first, right, and allow your body to digest, and so that you don't dilute the digestive fluids inside your belly, and you allow the digestive process to take place, and then you can drink half an hour after, right, Auntie Madge? Yes. It's 2 hours. Thank you. Okay, sorry, I mixed up the times. So half an hour before and 2 hours after in terms of drinking. All right. So if there are no other questions, I have some questions for you, brethren. All right. So I want you to name 3 procedures other than fillings and cleanings and extractions that you can do at the dentist. You need to answer the question that you were telling me.
Okay, I have a question.
So hold on, we're pausing this question for a minute.
Yes.
Elder Sterling has a question.
The mouthwash that we use, is all mouthwash good to use? Because we have some cheap one, and we have Listerine, and we have some different brands. What is the best mouthwash to use, or all mouthwash safe to use?
Okay, so all right, mouthwash. This is a tricky one because I don't want the companies to. This is being live streamed, okay? So we're not all together by ourselves. So in terms of the mouthwash most mouthwashes have alcohol in there, and alcohol is a potent antiseptic. So in that regard, it really helps to get rid of or control the bacteria that is in your mouth. But alcohol is also a causative agent of oral cancer. So my professor, who is the oral and maxillofacial pathologist, I think he's the only one in the Caribbean at this moment, he does not really endorse mouthwashes that contain alcohol for that purpose, because there are 3 main causative agents or risk factors of oral cancer, and these are alcoholism or drinking alcohol on a regular basis, also exposure to human papilloma virus, which is usually by oral sex, and also smoking, right? So we want to limit our exposure to these things that cause oral cancer. All right?
Thank you.
All right, so moving on now to my questions for you. Name 3 procedures other than fillings and cleanings and extractions that we can do at the dentist. Raise your hands. Yay! So name 3. No, you have to name 3. Come now. Come. 3 procedures other than fillings, cleanings, and extractions that you can do at the dentist.
Dentures,
Yes.
crowning,
Yes.
implant.
Wait, you got help. It's what? It ain't easy at all. All right. So, because you were so brave, my sponsors, Colgate, supplied me with some things to give you guys. So, definitely the answer was right. How this go now? Hold on.
Put down your hand, put down your hands.
Right. So root canals, crowns, implants, and dentures. So he got all of them. Very good. How often should we floss? Wait, no, your hand was up before the question finished. Whose hand was up first?
All right, me.
Hold on.
Every day.
Hold on. How many? The question says how many?
How many?
Hold on, you get your chance already. Somebody else. Come. Yes, all right. You.
Him?
You? Yes, him.
1 time per day.
Very good. Yes. I don't have any floss for you guys. I'm so sorry, right? I was trying to get CariMed to sponsor, but they have not responded. So the next, once per day. How often should you sleep in your dentures?
Sister Sterling.
Hold on, we're raising our hands. We're raising our hands.
Never.
Right? What you want? Toothpaste or floss? Or all right. So we should never sleep in our dentures, right? Okay. So we're gonna move now into a small survey. All right, so I'm going to ask a few questions, guys, and I'm going to ask you to participate as much as possible.
Sorry, elders. Which one are you elders doing this?
I don't need somebody. I need a counter. Come. I need yes, come. You have to count very well, you know. You have to count very well. Come, Lamar.
Oh, come. Wanna sit down? All right, come.
Or we can use 2. One over here and one over that side. Come, you go over that side. Now I want you guys to count the hands that you see. Right? So so we're wrapping up, guys. We're wrapping up. Who has never been to the dentist?
Who have never been to the
By show of
dentist?
hands, who has never been to the dentist? For no reason whatsoever.
None.
You have never been to the dentist. No, so you need to count the hands and tell me.
2.
So two on this side.
None.
No, children need to answer too, you know, right? If you have never been to the dentist, you need to raise your hand. Right? So 2, okay. All right. Have you ever felt pain in your teeth? So all the people who were telling me that they felt pain in their teeth, so please raise your hand. Have you ever felt pain in your teeth?
2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15,
17
16,
over
17,
here.
18.
So 18 in total.
18 in total, Gary.
19. Your gums bleed when you brush? Do your gums bleed when you brush?
1, 2, 3, 4, 5, 6, 7, 8, 9. 13.
13, okay, good. You visit the dentist every 6 months.
You visit the dentist every 6 months.
4. Very good.
4.
You visited the dentist when something was wrong. You visited the dentist when something was wrong.
1, 2, 3, 4, 5. 9 plus 5 is 14.
You were or are afraid of the dentist.
And 2 over here, 10. And 2 over this side, 10.
You will visit the dentist more often after this presentation.
That's right. And 2, 9 plus 2, 11.
All right. Do you think that you have to travel too far to see the dentist? No.
None.
0. All right. Would you visit the dentist if the dentist was closer? Okay. All right. So in terms of costs, what amount are you most comfortable spending at the dentist? Less than or equal to $5,000? Please raise your hands. So we have 4 options there. Less than, that's supposed to be less than 5,000 or equal 5,000. 5 to 15,000, 15 to 30,000, and greater than $30,000. Right? So those who say greater than $30,000, you'd be willing to spend $30,000 and more. Raise your hand, please. Raise your hand so that they can count it.
None.
Your hand was up?
No, not for that one.
Your hand. So 1, we have 1 hand. You will be willing to spend $15,000 to $30,000. 1, 5 to 15.
1, 2, 3, 4.
Okay, and less than 5,000.
Did we enjoy the presentation?
All right. Did you enjoy the presentation? Please raise your hand.
Seventeen and 6. 17 and 6.
How much did you learn from this presentation? Did you learn a lot? There's 3 options. I knew some of the things already, and the third one is I knew everything about going to the dentist.
Some.
So for those who say I learned a lot,
None. 2, 3, 4,
that's it.
5.
Those who say I knew some of the things already.
1, 2, 3, 4, 5, 6, 7, 8. 7 and 3.
All right, and those who say I knew everything about going to the dentist already. All right. Will you now visit the dentist every 6 months for those who don't?
Yes.
Raise your hand.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And 2 over here, 10.
All right. So that's a crazy picture of me at Hellshire one day when the water crept up on me unexpectedly. And my phone took a selfie. I don't know how I did it, but thought I'd share a piece of that with you guys. Thank you for having me. So I have some giveaways for you guys, but it's not enough for everybody. So I'll try to pass around as much as possible. All right?
We'll do it professional.
All right, so I'll give it to Elder Sterling and he will do it nice.
Okay, members, let us give a round of applause to Sister Williams. At this time, I wanted to give her a wonderful gift, but tomorrow you will get your wonderful gift because your wonderful gift is a part of this wonderful basket here, right? Yes, it is right here. So tomorrow you will get your wonderful gift. But thanks for the presentation. Thanks for taking the time out to share with us. I know that we have learned something, and I hope and pray that we will now take better care of our teeth. I now turn over to Elder Wint, who will take us through Vesper service, and then I expect to see all of us here tomorrow for our Grand Harvest Day. Thank you very much.
At this time, our thoughts should turn back to sunset yesterday evening. What did you anticipate that the Sabbath would have been for you? Did you look forward to the Sabbath at sunset yesterday? What about it that you look forward to? Have you been satisfied? Have you been satisfied? Did you find it? Was it a closer walk with God? Was it better fellowship, deeper fellowship with the brethren? Did you find that you were blessed tremendously today? Did anything speak to you personally? And as you leave at the close of the Sabbath, what is it that you're taking with you today? What is it that you're taking? Are you more strengthened to go out in a new and untried week? This is the moment of your final contemplation and meditation. And you just have a minute, young people, young ones in the front. You're going to put away all the talking and the playing now, and you're going to be reverent in God's house. What is it? We didn't come to a party today. We came to meet the King of Kings. Did you meet him? Did you meet him? It's a personal question. Did you meet him today? Is your life changed? Just questions that should go through your mind for every Sabbath that you have come up here today. When you leave here and the new week begins, are you going out strengthened to meet all the different trials, activities? You feel empowered to be Christ's witness? What can you take away from church today or your interactions today that you can share with somebody to say, well, this Sabbath, this was what touched me, and so I want to share it with somebody else? May I be so presumptuous to say, if something didn't happen to you today, then this Sabbath indeed would have gone down as a loss in history. So let us just for a moment, each person, silently ask God, in your seats where you are, just close your eyes and ask God that even at this minute, Lord, impress my heart with something that I might have missed today that you want me to get. And let me experience it even now, that today will not go down into eternity as a day that I have missed. Amen. And then the theme of today, we come rejoicing. Let us leave God's course rejoicing today. Let us leave his course rejoicing. And as we go through the week, may we find a reason to tell others why we rejoice and why God deserves our praise continually. We close then this moment with hymn 56, first and last. The day thou gavest, Lord, is ended. The darkness falls at thy behest. To thee our morning hymns ascended. Thy praise shall hallow now our rest. And then verse 4. And then Elder Otti will pray that God will guide us, strengthen us, and lead us in a closer relationship with him as we go through the week. Shall we stand? The day thou gavest, Lord, is ended. The darkness falls thy behest. To thee morning hymns ascended. Thy praise shall hallow now our rest. So be it, Lord. So be it, Lord, thy throne shall never, like earth's proud embers, pass away. Thy kingdom stands and grows forever, till all thy creatures,
Let us pray. But before we do, Elder asked that she hoped that there was something that we took away from the service today. I didn't worship here today, but in contemplation, something came across my mind. And it brought one particular hymn to my mind. A hymn that a lot of us know, Elder, 322. Nothing between my soul and my Savior. And as I thought about it, I say, with what you have just said, Elder, I want us to go away with this in mind. The refrain says, nothing between my soul and my Savior, so that his blessed face may be seen. Nothing preventing the least of his favor. Keep the way clear, let nothing between. Let us pray. Our Father and our God, Creator, Redeemer, and Friend, we thank you, Lord, for having taken us into your courts one more time, for giving us the blessing of a Sabbath and reminding us that you are